Medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
As clinicians, so many of us check hormones all the time because we're looking to help people have more energy and better joie de vivre of life, of course, and a good libido. I think we forget that it's an intricate part of an entire system that makes us up, including the immune system. So this will help you remember, hey, Dr. Mitch Genn. The immune cells, by the way, synthesize, store, and they secrete hormones. And they do these just like any other hormones that are made. The type of hormones that are made are the pro-opiomelanocortin hormones, which we call the POMC. They're the pituitary precursors, and they're like circulating melanocyte-stimulating hormone, ACTH, endorphins. But in addition, there's thyroid hormones that the immune system secretes, growth hormone, prolactin, melatonin, histamine, serotonin, catecholamines, renin, VIP. Yes, the immune system does secrete and needs these hormones and helps make them. Well, what this means is that the immune system contains all these hormones, which were searched at all places, and receptors of these hormones basically everywhere. So hormonal changes that occur with aging, what does that mean? Because we know the hormones break off with aging. It means there will be a decreasing amount of hormones made, for example, from the pineal gland. You know, melatonin breaks off, growth hormone breaks off, adrenal hormones break off, the youth hormone dihydroepiandrosterone, and even the active hormone vitamin D. The question is, of course, do these contribute to immunosenescence? Well, it's true. As people get older, they have more cancer, they have more immune dysfunctional disorders. And as a clinician, you're going to want to be able to clearly establish if this is fact or it's fiction. For sure, in most cases, the decline of hormones with aging, it is highly likely, as noted by the physiology we just discussed, it will affect immune system function. So what I'm saying is that if you want a true wellness program, you must take into consideration hormone health, not for the typical things that lay people think about, but us as clinicians in cellular physiologic medicine, that inevitably, if the immune system is not producing and has also receptors for these hormones, then there's going to be a loss of immune system integrity. Articles that are there support these relationships pretty much, if not all, chronic diseases such as dementia, cardiovascular disease, general inflammation, autoimmune disease, and cancer. There are direct links that have been shown in hundreds of studies that cortisol levels lead to pretty much most chronic diseases. And we've talked about some of these in the past. So let me just summarize the takeaway. Next time you see a patient, in my clinical professional experience, it should be more than just, oh, look, I did the hormones, they're low. I guess your libido's not good, you don't have as much energy. Now think, test these hormones, not just for sex and to see what they are tired of, but develop the competency of the immune system by repleting these hormones. Get a full panel of hormones so that deficits will become obvious to you. And if possible, replete these hormones to youthful levels. And please don't forget that labs often skew their levels for age. The same normal of DHEA, testosterone, estrogen for a person 30 years old is very different than the numbers you're going to see at 75. Learn more? Check out drmitchgenn.com, drmitchgenn.com. Thanks for watching.